Right now, today, here is where you are. You have high blood pressure. You take medication for it, maybe an ACE inhibitor, maybe a calcium channel blocker, maybe a beta blocker, maybe more than one. And most days, the numbers stay in range. The medication does its job. But it never actually goes away, does it? The pill manages the pressure. But the moment you stop taking it, the numbers climb right back up. And somewhere in the back of your mind, there's a question you've never asked out loud. Is there something that actually addresses why my blood pressure is high in the first place, instead of just holding it down from the outside? There is. But to understand why it works, we need to do something your doctor probably never did. We need to rewind, not to a different treatment, just to the beginning of the chain, the very first domino that fell, maybe years or decades ago, that eventually became the high number on your monitor today. Before we start, and I cannot say this strongly enough, I am not a doctor. High blood pressure is the leading risk factor for heart attack and stroke worldwide. If your doctor prescribed medication, there is a clinical reason. Do not stop it. Do not reduce it on your own. What I'm doing today is walking you through published research that traces this condition backward, link by link, to show you where the problem actually started and where a natural approach may be able to help, alongside your current treatment, not instead of it. Always talk to your doctor before changing anything. Link 5. The symptom. Let's start here. The most recent link in the chain. But this is the number on your blood pressure monitor. The 140/90. The 155/95. Whatever your number is, this is what your medication is designed to address. What's physically happening? Your heart is pumping blood through your arteries, and the force of that blood against your arterial walls is too high. That force, measured in millimeters of mercury, is your blood pressure. When it stays elevated chronically, it damages the walls of your arteries, strains your heart, and dramatically increases your risk of heart attack, stroke, kidney disease, and heart failure. Your medication lives here. At link 5, an ACE inhibitor blocks an enzyme that narrows blood vessels. A calcium channel blocker relaxes the muscles in your arterial walls. A beta blocker slows your heart rate and reduces the force of each heartbeat. Each of these approaches reduces the pressure, and at this link, they work. The number comes down. But here's the question nobody asks. What caused the pressure to be high in the first place? What's happening one link deeper that made the number climb? Let's rewind. Link 4. The mechanism that broke. Before your blood pressure was high, something had to change in how your blood vessels function. That something, in a large proportion of cases, is a loss of vascular flexibility. Your arteries are not rigid pipes. They're elastic, muscular tubes that expand and contract with every heartbeat. When they're healthy, they flex, absorbing the pressure of each beat like a shock absorber. When they stiffen, when they lose that elasticity, every heartbeat slams against a wall that doesn't give. The pressure spikes. And this stiffening is called arterial stiffness, and it's now recognized as both a cause and consequence of hypertension. A 2010 study published in the Journal of the American College of Cardiology found that arterial stiffness precedes the development of hypertension, meaning the arteries stiffen first and the high blood pressure follows. It's not just a symptom, it's a driver. Your medication doesn't reverse arterial stiffness. It manages the pressure that results from it. The stiffness is still there, underneath, getting slowly worse. So what caused the arteries to stiffen? Let's go one more step back. Link 3. The system under stress. Your arteries are lined with a single layer of cells called the endothelium. Think of it as the inner skin of your blood vessels. This endothelial layer is not passive wallpaper. It's an active, dynamic organ that produces a molecule called nitric oxide, NO, which is one of the most important substances in your cardiovascular system. Nitric oxide tells your arterial walls to relax, to dilate, to stay flexible. When your endothelium produces enough nitric oxide, your arteries open up, blood flows freely, and pressure stays normal. When nitric oxide production drops, a condition called endothelial dysfunction, your arteries lose their ability to relax. They constrict. They stiffen. Pressure rises. A landmark 1997 study published in The Lancet by Forte and colleagues found that basal nitric oxide production is significantly reduced in patients with essential hypertension compared to healthy controls. The system that keeps your arteries flexible is running on empty. And here's the thing. Your blood pressure pill doesn't restore nitric oxide production. Some medications work around the nitric oxide pathway, but they don't rebuild the endothelium's ability to produce it. The system is still impaired. The drug is managing the consequence 3 links down the chain. What's depleting your nitric oxide? Let's rewind one more step. Link 2. The environment that damaged the system. Nitric oxide production declines for several interconnected reasons, and this is where your daily life enters the chain. Chronic oxidative stress, an imbalance between free radicals and antioxidants in your body, directly damages the endothelial cells that produce nitric oxide. Aging naturally reduces endothelial function. A diet low in dietary nitrate, the raw material your body can convert into nitric oxide through an alternative pathway, leaves your system short of substrate. Sedentary lifestyle reduces the sheer stress on arterial walls that stimulates nitric oxide production. And this is the part that should concern you. Some medications themselves may affect nitric oxide metabolism. A 2011 review published in the American Journal of Physiology by Zhang and colleagues documented the mechanisms by which endothelial nitric oxide synthase, the enzyme that produces NO, becomes dysfunctional, a process called eNOS uncoupling. When this happens, the enzyme that's supposed to produce nitric oxide starts producing superoxide, a free radical, instead. Your NO-producing machinery becomes a damage-producing machinery. Your daily environment, diet, activity level, stress, is quietly eroding the system that was supposed to keep your blood pressure normal. And the medication at Link 5 that is managing what comes out at the end of this chain. It never goes back this far. But there's still one more step. The foundation underneath all of this. Link 1. The origin. At the very bottom of this chain, the first domino, is a simple, measurable deficiency. Your body doesn't have enough bioavailable nitric oxide, and it doesn't have enough of the raw material to make more. Your body produces nitric oxide through 2 pathways. The first is the enzymatic pathway. Your endothelial cells convert the amino acid L-arginine into NO using the enzyme eNOS. This pathway declines with age and endothelial damage. But there's a second pathway, the dietary nitrate pathway. What when you consume foods rich in inorganic nitrate, bacteria on your tongue convert the nitrate to nitrite. That nitrite enters your bloodstream and is further converted to nitric oxide, bypassing the damaged endothelium entirely. This second pathway is a backup system your body was designed to use. But most modern diets are profoundly deficient in dietary nitrate. The average Western diet provides a fraction of what our ancestors consumed from nitrate-rich vegetables and roots. And this is exactly where beetroot enters the chain. Not at link 5, where your pill lives, at link 1, at the origin. Beetroot is one of the most concentrated natural sources of dietary nitrate on the planet. When you consume beetroot juice, the nitrate enters the dietary nitrite-nitric oxide pathway and directly increases circulating levels of nitric oxide, restoring what your damaged endothelium can no longer produce on its own. The landmark clinical trial on this was published in 2015 in the journal Hypertension, one of the most prestigious cardiovascular journals in the world, by Kapil and colleagues at Queen Mary University of London. This was a randomized, double-blind, placebo-controlled trial, gold standard research, involving 68 patients with hypertension. Half received 250 milliliters of nitrate-rich beetroot juice daily. Half received nitrate-depleted beetroot juice as placebo. After 4 weeks, the beetroot juice group showed a mean reduction in systolic blood pressure of approximately 8 to 9 millimeters of mercury. Just to put that in context, that magnitude of reduction is comparable to what many blood pressure medications achieve. From a root vegetable. A 2022 meta-analysis published in Frontiers in Nutrition analyzed multiple randomized controlled trials, specifically in hypertensive patients, and found that beetroot juice consumption reduced systolic blood pressure by approximately 3.5 millimeters of mercury and diastolic by approximately 1.3 millimeters of mercury across studies. The researchers noted that a reduction of just 2 millimeters of mercury in systolic blood pressure can reduce mortality from heart disease by 7% and stroke mortality by 10%. These are clinically meaningful numbers from a dietary intervention. And a 2019 systematic review published in Biomolecules found that across 11 clinical trials, beetroot juice supplementation demonstrated consistent potential to reduce blood pressure in both healthy and hypertensive populations. The drug sits at link 5 and manages the pressure. The beetroot sits at link 1 and supplies the raw material your body has been missing, the nitrate it needs to produce the nitric oxide that keeps arteries flexible, open, and healthy. Here's the full chain, beginning to end. Link 1. Nitric oxide deficiency from inadequate dietary nitrate and endothelial dysfunction. That drives link 2. Chronic oxidative stress and ENOS uncoupling deplete your vascular protection system. That weakens link 3. Your endothelium loses the ability to produce enough nitric oxide. That breaks link 4. Your arteries stiffen and lose elasticity. That creates link 5, the high number on your blood pressure monitor. Your medication sits at link 5 and manages the pressure. Beetroot juice sits at link 1 and replenishes the nitric oxide substrate your body has been starving for. One strategy manages the end of the chain. The other feeds the beginning. Here's the protocol. The form used in the most significant clinical trials is beetroot juice, specifically concentrated beetroot juice or standard beetroot juice rich in dietary nitrate. The Kapil study used 250 milliliters, roughly 1 cup, of beetroot juice daily. Concentrated beetroot shots, 70 milliliter shots containing approximately 400 milligrams of nitrate, are also available and were used in several trials. Timing: morning is ideal. The blood pressure lowering effect of beetroot juice peaks approximately 3 to 4 hours after consumption and can persist for up to 24 hours with daily use. Drinking it in the morning provides coverage through the day. An important detail most people don't know: do not use antibacterial mouthwash right before or after drinking beetroot juice. The conversion of nitrate to nitrite depends on specific bacteria on your tongue. Antibacterial mouthwash kills those bacteria and can significantly reduce the blood pressure lowering effect. A 2019 study published in Free Radical Biology and Medicine found that using antiseptic mouthwash twice daily was associated with increased blood pressure, precisely because it disrupts the oral nitrate to nitrite conversion pathway. This is one of the most overlooked details in cardiovascular health. But timeline. Some acute blood pressure reduction can be measured within 3 to 6 hours of a single dose. Sustained daily reduction typically becomes consistent within 1 to 2 weeks. The 4-week mark is where the most significant trial data was collected. Where to get it? Pure beetroot juice is available at most grocery stores and health food stores. Look for 100% beetroot juice with no added sugars. Concentrated beetroot shots are available online and in health stores. Brands like Beat It and others have been used in clinical research. A month's supply runs approximately $20 to $40, depending on the form. Contraindications. Critical. If you are on blood pressure medication, adding beetroot juice may enhance the blood pressure lowering effect, which could cause your pressure to drop too low, a condition called hypotension. Monitor your readings closely and inform your doctor. If you are on blood thinners, consult your doctor. Beetroot has mild antiplatelet properties. If you have a history of kidney stones, note that beetroot is high in oxalates, which can contribute to calcium oxalate stones in susceptible individuals. If you are diabetic, beetroot juice contains natural sugars. Factor it into your carbohydrate intake. The most common mistake: people drink beetroot juice once, check their blood pressure an hour later, don't see a dramatic change, and give up. The acute effects are modest in many people. The sustained effects build over days and weeks of consistent daily use. Commit to at least 4 weeks. That's the timeline the strongest clinical evidence supports. And one more thing. Your beet juice might turn your urine and stool pink or red. It's harmless. It's called beeturia. Don't panic. It's not blood. It's beets. You've been treating Link 5 for years. Link 1 has been waiting for you the whole time, and the answer was never a stronger pill. It was going back far enough to find where the chain actually started, and giving your body the raw material it's been missing. A glass of beetroot juice costs about $1. It feeds a pathway your body was designed to use, and in published, peer-reviewed clinical research, it has produced blood pressure reductions comparable to what some medications achieve, not by forcing the pressure down from the outside, but by restoring the system that was supposed to regulate it from the inside. One final time, and I mean this with everything I have. Do not stop your blood pressure medication. Uncontrolled hypertension is a medical emergency waiting to happen. What I've given you today is a map of the chain that nobody ever drew for you. Beetroot juice is not a replacement for your prescription. It is a potential complement to it, one supported by clinical research and worth discussing with your cardiologist. Bring this to your next appointment. Mention the Capil 2015 study in hypertension. Ask your doctor, could dietary nitrate from beetroot juice complement my current treatment? That's the conversation worth having. You deserve to see the full chain, not just the last link. If someone you care about has been managing their blood pressure at Link 5 for years and has never seen the full chain, send them this video. That's how this information travels. One person showing another person the map they were never given.